So, like I said, we're going to look at the triggers, we're going to look at our body's responses, and we're going to look at tools to manage. So, what triggers your stress response? And everybody comes in the office and they see this big safety pin that we have here hanging up that is a new addition to the office. It just came here about last month. Everybody says, what's the deal with the safety pin? Does anybody know what the deal is with the safety pin?
Doesn't stress.
Doesn't stress. The safety pin is very similar to the top of the pin is like our brain. And we're sending signals constantly out to our body and back. And there's a big loop. Okay? And when you're not subluxated and when you're not under stress, it's a closed loop. However, let's see if I can do this without killing myself. When you start to stress, when you subluxate and those signals are cut off, our safety pin pops open. And now that loop is no longer closed. So those messages are not getting through. And stress causes subluxations, and subluxations cause stress. So that's what, when you see the safety pin hanging up, that's what it means. And I need you guys, when you come in here and you hear somebody say, hey, what's that safety pin about? You now know, so you can tell the next person. Safety pin and the stress response go hand in hand, okay? And I encourage you to take it off the wall and play with it. Just don't break it, because then I'll be mad. So that's our safety pin. So the question becomes, what triggers your safety pin to pop open? What are your triggers? And we went through a few of them already. But like I said, the body sends messages to the brain. Where do these messages come from that the body's getting? Body sending messages to the brain. Where are the messages from the body coming from?
Nervous system, organ, nerves, that where is it attached?
How about the environment?
Oh.
Like a message that the body could send to the brain is, I'm cold, I'm hot, things like that. It's detecting things in the environment. It can see something stressful and send messages to the brain, like this car is about to hit me, swerve, things like that, okay? So we're detecting things in our environment. I see my daughter coming in the room, like that. Stressful situations. I have to go to work today. So these are the signals that we're always detecting from the environment. Now, the brain is going to send messages back to the body, telling the body what to do. And these messages allow the body to respond in a healthy manner to the environment so that we can survive and thrive. What does that mean?
Kind of like a release.
Kind of like a release. We can survive and thrive. Our bodies are programmed for health. Every cell in our body is programmed for health. So when we detect something in the environment, are we going to do something healthy to survive? Or are we going to cause our bodies to shut down and crash? No. Our bodies are programmed for health. So we detect something, we're going to start to kick in some responses in the body to keep us living, to keep us safe. So think about that. So here's the physiology. We're going to have a detailed look at what happens in our bodies when we encounter a stressful environment. Now, the stress response, as we're talking about it, was designed in our bodies for an immediate stressful event. Let's go back and look at our hunter-gatherer ancestors. What was an immediate stressful event? A tiger jumping out at you as you're walking along, picking your berries, enjoying your life, gathering food for your families. This guy jumps out at you. This is what sets off the stress response. This is what it was meant to be, and this is what it's still today designed to be in our bodies. How many people have had a tiger jump out at them? Raise your hand if you have.
Bosses count?
Bosses count, yeah. But how many people have had a tiger jump out at them in the woods when they're doing their morning walk collecting their berries? Not many. But again, our bodies weren't meant to live in this environment. That's the environment they were meant to live in. So what happens in our body when we encounter a stressful situation like a tiger?
Fight or flight.
Fight or flight, thank you. The first thing that happens is fight or flight. That's initiated immediately. Did you just say smart? Who said smart? Stop oogling her husband.
I'm not. He hasn't been here that long, and he remembers that.
So, flight or fight. What does flight or fight mean?
Either stand your ground and fight, or you run.
Yes. You're either going to get ready to fight that tiger, or you're going to take off, right? So what happens to our heart rate in either way, if we're ready to fight or we're going to run? What happens to our heart rate? It increases. What happens to our blood pressure?
Increases too.
It increases. We need to shoot blood where? Where do we need the blood in a fight or flight situation?
Your
Extremities.
Your extremities. Do we need it in our stomachs doing digestion? Do we need it in our cells to fight off viruses at that moment? Do we need it in our brains for solving complicated math problems in that moment? No. We need the blood to go out to our extremities. So all the blood shoots out to our extremities. We're in fight or flight. Our heart rate's up. Our blood pressure's up. There are other things that are happening too. But as those go up, heart rate and blood pressure, what goes down is sex drive. We're not thinking about that in that moment, trust me. Digestion, growth, and cellular, that's such a hard one to say, immunity. All of those are being down-regulated, we call it. They're being slowed and shut down. We don't need that. Our bodies are programmed to keep us living in that moment. Does that make sense? Okay. So what happens to our blood sugar? Where do we need blood sugar? And what is blood sugar for? Energy. Do we need blood sugar at that moment? Do we need energy? Oh, you bet your bottom dollar we do. So guess what? The blood sugar increases. We need it in our blood so we can use it quickly. So we're not storing blood. Our blood sugar goes up. Make sense? If I lose anybody, tell me. How about sticky factors and platelets, which are really important for wound protection? Do we need them?
Yes.
So what happens to our blood? Does it get thicker or thinner in that moment? Thicker. Our blood just got thicker. Our heart rate went up, our blood pressure went up, our blood got thicker, and our blood sugar went up. What happens to, like I said, concentration? Are we able to concentrate on solving math problems?
No.
Absolutely not. We will sharpen our signal detection though, meaning we're jumpy, right? But we can't sit there and concentrate on anything. We need to be ready to hightail it out of there if we have to. So cortisol is another hormone that gets released during this process, and that has so much to do with our cholesterol levels. Cortisol, who knows what cholesterol is for?
Lines the arteries?
It lines the arteries. Why? For wound clotting and mood regulation. So is our cholesterol going to go up in that moment? Do we need wound clotting? Or is it going to go down?
No.
It's going to go up. So we have an increase in cholesterol. Now, we're at this situation where all of these things are happening in our body because we need to survive, and the tiger decides that he sees a really pretty female tiger over there, leaves us alone, and walks away. Now what's supposed to happen to our bodies? It relaxes, restabilizes, it returns to normal. So here we are in fight or flight, and all these things are up, and then the tiger goes away, the threat is gone. In our lives, in our everyday life today, does that tiger go away?
No.
That tiger's there all the time. So we're looking at increased cholesterol, we're looking at decreased attention, we're looking at increased blood pressure, we're looking at increased heart rates. We're looking at increased blood sugar. Did I say that one? So we're looking at all these things, and what are we doing when we see all these symptoms that are all normal responses to stress? What do? We medicate them. We diagnose them. We give them a name. High blood pressure, high cholesterol, diabetes, ADD, you name it. And we try to get the body to lower the cholesterol. Now, the body's in a stress, fight or flight response. It needs the cholesterol, so it's going to keep raising it. So now we're fighting a medication on top of trying to fight the environment. Would it make more sense to maybe manage our stress a little better, or to medicate the symptoms? Oh, okay, you can all go home. All right, so we also, these are some things we didn't even get into, but we have increased cravings for sugar when we're under stress. Why would that be? What's sugar for?
Energy.
Energy. In that moment, do we need energy? In our lives today, do we need energy? We're constantly craving sugars. And in today's society, we're not even getting natural sugars, we're getting the fructoses and all these horrible sugars that we're not supposed to have. So our body's not turning off those cravings because we're not eating the natural sugars that we're meant to have for energy. Then insulin resistance and easier weight gain are a product of that. Okay, so now we've got a stressed out, overweight society that's coming up with all these diseases, and don't worry about it because we have a drug for each and every one of the symptoms that your body just manifested. So this is just basically a summary of what happens when you're under stress. From increased heart rate, blood pressure, blood glucose levels, blood cholesterol levels, clotting factors, degradation of muscle and connective tissue, insulin resistance, increased feelings of stress, fear, anxiety, and depression, decreased short-term memory, ability to concentrate and learn new material, decreased serotonin levels, can't even sleep, right, Ann?
Right.
Right. Increased noradrenaline levels, they keep us awake, increased sensitivity of sensory systems, including those for pain, fibromyalgias, okay, decreased cellular immunity, people getting sick all the time, and decreased anabolic hormones like growth hormones and testosterone. Nobody wants to have sex anymore. And, of course, bone loss, osteoporosis. Is that every major disease in society that we're fighting today? And that's a normal response of our bodies. How crazy is that? Did anybody ever think of it this way? I'm glad you're all here then. Okay, so again, every cell in our body is programmed for health. Our body's constantly striving for something called homeostasis. These diseases do not exist. Sickness is our body trying to return to homeostasis. If we're raising our cholesterol, it's because there is a fight or flight response going on, and we've got to get the heck out of there. You can't, things like diabetes, you can't take it out. You can't remove it. It doesn't truly exist. It's just, again, our body's natural response to a crazy environment that humans were never meant to exist in. So again, and I asked you this question already, should we be treating the symptoms? And what do the studies show with blood pressure medications, cholesterol medications? What do the studies show? Do they work? They do work. They're extremely effective in lowering cholesterol. They're extremely effective in lowering blood pressure. They're also extremely effective in lowering your lifespan. You will die earlier on these medications. Don't take it from me. Please look at the research yourself. That's what it shows. Okay? So let's talk about some tools to manage stress. And I'm pretty sure that each and every one of the things that we're going to talk about here, we actually have an entire workshop on each category. So the first one is prioritize. Deal with one thing at a time, and remember your needs come first. What does that mean? That means that when you're completely stressed out and you're running late and the world is overwhelming you, the first thing you do is cancel your adjustment. And you just negated that whole first rule. Those are the times when you need to get actually more adjustments. Your body needs to return to homeostasis quicker. The adjustments will help with that. So instead of not taking care of yourself in that moment, the best thing you can do is slow down and take care of your needs first. And I am the worst at making sure I am properly fed during the day. I actually went to get my car serviced yesterday. This is the funniest story you've ever heard. My car had a recall, and I ran from here. I was doing coaching calls in the morning. I ran right over to the new office to meet the architect. I was late for the appointment to get my car done, so I run in there, and it's going to take an hour. And I'm looking going, I haven't eaten anything, and it's 12 o'clock. I can't believe it. I'm going to faint. So they have a tea and coffee machine, and I won't drink coffee. So I start to get some tea out of it, and this man comes up to me and says, do you need help with that? I'm like, I don't think so. He's like, you don't know how that works. I said, well, can I at least try? He goes, go ahead. So I try, and I didn't get it right. So he says, let me do it for you. The next thing you know, we get to talking. He's the financial guy that I sat down with when I first bought my car. He brings me into his office with the guy that sold me the car. He sees me. They come running over. We start talking about chiropractic and health and diet and blah, blah, blah. And I'm like, I'm starving. And he's like, I have food. So I'm sitting there, and he starts cutting up plums for me. And it was the sweetest thing. So I'm sitting there eating my plums, and they come in. They're like, your car's ready. I said, yeah, but I'm not. I need a few more minutes. I had the best time getting my car serviced. And it was good because this guy was a real health nut, And he learned something in the exchange, and he had plums, fresh plums. I was so excited. So it really worked out well. But again, I am really not good at making sure that I get the proper nutrients during the day sometimes. Thank God Denise will hand me mangoes. Like, that's her new thing. She brings me sliced mangoes in the morning that keep me going. Dana's always filling my teacup and making sure I have plenty of water. And Mary Lou's just sneering at me. No, I'm kidding.
Somebody's got to keep her in line.
This one, Mary Lou says to me, Dr. Suzi, you need to go for your adjustment. And she kicks me out and makes me go. And, like, you know, I've got the most supportive team, and I'm just so grateful for that. So, really, when things get tougher, that's when you need to buckle down and take care of yourself more. That's when you can't come off your nutrition or your exercise or your adjustments for sure. Okay? And when that happens, the stress kind of goes away. When you're not doing that and you're letting the stress run you, it gets worse. And you get run down and sick on top of it. So everything gets worse. Journal, get it off your mind and onto paper. This is something that I truly believe in, especially when it comes to making lists and you try to remember so much and you can't. Calendars, lists, whatever it is that you need to get it off your mind and onto paper so that you're constantly not feeling like you have to remember everything, not putting that pressure back on yourself. Schedule in downtime, especially when you're the most busy and you have no time for it. That's when it's most important, whether it's to go for a walk, take a nap, meditate, I don't care what it is. That has to be the first thing that you schedule in the week, not the last. Go for a walk. Motion has been shown to decrease stress levels. Getting that motion, getting out in the environment, in the wintertime, go to the mall, I don't care, but getting motion, actually that back and forth movement calms the brain down. So that's an excellent, excellent thing to do. And always avoid processed sugar. It's when we have a sugar craving, we think we want that Milky Way. Our body's actually saying, I want fruit. Or I want something sweet that's healthy, not something sweet that's processed. That kicks you more into a stress response. And of course, you got to get adjusted, like I said before. Lack of motion, as far as walking, will definitely create an adjustment. Will definitely set off the stress response. Subluxations are lack of motion segmentally. Every spinal bone is meant to move. When it doesn't move, it starts sending rapid impulses to the brain, which sets off the stress response in the body. So people ask me, hey, does getting adjusted have anything to do with mental health? Like, you tell me. Get adjusted. How many of you have got adjusted and not wanted to get off the table because all of a sudden you just feel completely and totally relaxed? Right? Okay, so, and I've actually had like husbands and wives getting adjusted, and the husbands have said to me, she's so much nicer since she's getting adjusted. I mean, it makes a huge, huge difference. So it is one of the best natural reducers of stress. Motion, segmentally and globally. Segmentally means the adjustment, globally means the whole body. You have to exercise. And I have so many patients that are doing so many things right, and they're just missing one piece of it. Like, I eat well, and I get adjusted, and I sleep well, and I'm drinking my water. Are you exercising? And that's the one little thing that just causes everything else to tumble. Okay? You got to do that. All right. So, with all that said, one of my patients once came in and said to me, you're too blessed to be stressed. And I looked at him and I said, you know what? You're right. And hearing things like that over and over, little reminders of we're not meant to be under chronic stress. We have to, again, focus on what's happening in the moment. It's called file draw thinking. Has anybody ever heard of that? File draw thinking. Focus where you are. Stop scattering your mind all over the place. Be in the moment. That reduces stress throughout your day as well. Okay? So when you're here, be here. When you're with the kids, be with the kids. When you're at work, be at work. Don't be thinking of everything else that you have to do. And that will start to give you an awareness that stress isn't going anywhere. Your response is what needs to change. You need to be okay with the fact that we live in a stressful environment. Does that make sense? Okay, so all of you have seen our gorgeous board up here. And you know, well, most of you know. If you don't know, you're going to know right now. In 2 weeks from today, we have our Patient Appreciation Day. Patient Appreciation Day is our chance to say thank you to our patients, because God knows we love you guys. We are so grateful for all the work you do for your spines, for your health. And the goal of Patient Appreciation Day is to give back to you and to say, hey, if you know someone that needs to be checked, make an appointment for them, and we'll do it at our expense. It doesn't mean that they need to become a patient. They never have to come back into the office again. But on that day, we're doing it at our expense, and we ask that before you leave tonight, if you think of someone, I don't know their schedules, I don't care. It's why it's a dry erase board. We can always change it. Put their name down, and we will give you an application for care to go with it. If we need to change it, it's okay. But get somebody you love checked. Everybody deserves to get checked. They just don't know it. And it's your job to tell them. So, with that said, thank you very much. Have a very peaceful evening. No